Let's speak to Dr. Lucy Johnstone. She's a consultant clinical psychologist and the author of several books warning of the dangers of the over-medicalisation of our emotions. She's in Bristol. Thank you so much for talking to us this afternoon. What are the things that are going to be normal for people to experience in this extraordinary situation?
Well, I very much welcome the normalising message. So it's going to be absolutely normal and understandable to be feeling anxious, to be feeling confused, to be feeling quite panicky and afraid at times, to perhaps not be sleeping so well. All these things are going to be absolutely normal and understandable. And I welcome Public Health England's message that, of course, in a sense, we're all in this together. I'd be more concerned, in a sense, about the 4 in 6 people who apparently aren't more worried than usual than about the 6 in 10 of us who are. So very much a normalising message. And along with that, I think it's important to say, as Public Health England have, that a lot of the things that we do to cope with that are normal, common sense things. They're about exercise, they're about sleep, they're about establishing new routines. They're about keeping in contact with each other as much as we can. And in a time of crisis, we have an instinct to be closer to the people we care for. It's not possible to do that in every case at the moment, of course, but technology can help. And we're seeing a lot of very kind of encouraging community initiatives about people keeping in contact with each other in various ways and coming together more, perhaps, than they have for a long time. So that is all very welcome.
It's interesting, isn't it? Because you have the fear of the pandemic and then a lot of people experiencing very real economic issues, and then you're all locked up in a house together.
Well, of course, that's going to be difficult. And I think that it's quite a difficult message to get the right balance for, actually. We want a normalising message and we want to promote that because...
What do you mean by that exactly?
What I mean is that I'm actually seeing some quite mixed messages about what people are experiencing. So along with the "we're all in it together" message, which we are, I'm also seeing some less helpful headlines about this is a mental health crisis, we're facing a pandemic of mental health problems and so on. And actually, if ever there was a good example of people's difficult feelings being an understandable response to an abnormal situation, this is it. And that kind of way of thinking does have some disadvantages. The idea that somehow, along with a pandemic and surviving that, we've suddenly been hit by a range of mental health problems by some strange coincidence would tend to lead to people perhaps feeling less competent to cope with support from each other, would tend perhaps to suggest that things like therapy and drugs should be a first-line response, which they aren't necessarily needed to be. Maybe further down the line, maybe when we see how well people are coming through all this. But at the moment, our best solutions in normal responses to difficult situations is to find support in community. And we can do that without very often placing extra burdens on our already overstretched NHS, because these are not mental health problems as such.
So it is normal to feel scared, it's normal to feel cooped up, anxious. What are some of the things that you can do to mitigate those feelings?
Well, again, they're common sense things in a way. So, again, it's a balance between acknowledging it's going to be very difficult to be cooped up and isolated, and particularly if you have young children, if you're not lucky enough to have an outside space, that's going to be difficult. But it's also, every crisis is an opportunity in a way. So for some people, this is a chance to do new things together, to have a break from stressful commuting, to spend more time with very close family members and so on. And there are a lot of creative ways of coping have been arising. We can keep connected by video, we can do online gym classes, we can teach our children via kind of virtual school classes and so on. It's not magic answers, it's not special psychological or medical answers. It's about thinking creatively together about how we can make, in some ways, bring some good things out of this very difficult time that we're now forced to spend, physically separated from each other, but hopefully not actually disconnected from each other.